Now I am going through interpersonal relationship. Interpersonal relationship means a relationship between the two individuals, means the two individuals having the similar character or state of being related, okay, then or it is called as what, affinity between the two individuals. Affinity means it's also like a similar quality between the two or more people or any things, that is called as interpersonal relationship, okay. Then now I go through types of relationship. Mainly three types is there in the relationship. First one, social relationship. Second one, therapeutic relationship. Third one, intimate relationship, okay. First one, social relationship means social relationship that is primarily established with the purpose of meeting mutual needs, which may range from friendship, socialization, enjoyment to accomplishing a task, okay. Example for the social relationship, example, part A, part B students are there, okay. Part A students and part B students, don't know anything, means they are like a strangers, okay. They are from another college. Part A students are from another college, then part B students are from another college, okay. Then both are going to what, participate in the cricket, okay. Then to participate in a particular cricket team, they need to combine, means they need to communicate each other, okay. That time why they are going to communicate each other, means they are having some task, yes or no. That cricket is a main task, okay. That time if they need to get a good result, means they have to communicate, means one purpose is there to communicate with the part A and part B students, okay. Means one particular task is there, that is cricket, that's why they need to communicate. Means strangers is there, we are going to what, communicate mutually with the strangers because to complete a task. This is called as social relationship, okay. Then intimate relationship. Intimate relationship means it develops between the two individuals who have an emotional commitment to each other, okay. That time this intimate relationship will start, okay, when two individuals is having same emotional commitments or same emotional behavior, that time this intimate relationship will get start, okay. Then therapeutic relationship. Therapeutic relationship means what, it is differs from social and also an intimate relationship, okay. Means it is between both social relationship and also between the intimate relationship. This is regarding interpersonal relationship with of the persons, okay. Then what are all the barriers in interpersonal relationship, means what are all the obstacles is there to what, avoid this interpersonal relationship, means what are all the barriers what are all the barriers which affecting this IPR, means first barrier what, physiological barrier, environmental barrier, psychological barrier, social barrier, then cultural barrier, semantic barrier, then organizational barrier, the communication barrier. First one, physiological barrier means when the nurses is going to speak with the patient, that time we don't know that patient is in which condition, yes or no. Means patient is having any pain or having any sensory deficit, means that time if the nurses is going to speak with the patient, means that time patient won't accept, okay. Physiological things also most important, means the body functions also most important to listen the information or to receive the information from the nurses, okay. If they are having any issues, means that time if the nurse said something also they won't listen, okay. This is also one of the barrier, that is physiological barrier. Then second barrier, environmental barrier, means if anything is happening in their surrounding, means any what fighting or something is arising in the what their environment, that time also they can't listen what we are saying, means surrounding also most important to maintain a good IPR, okay. Then third one, psychological barrier, means the person mental condition also most important, means psychological things also most important, means if the patient is in angry mode, if the nurses is saying something means that time they can't understand, they will scold the nurse only. Okay, that's why patient mental status or the psychological things also most important. If that is not good means that will also affect the nurse to maintain a good IPR. Then social barrier means the way of communicating or the important role in process of communication, that is social norm. Means the social barrier means while we are going to what means social barrier means according to the patient problem, if we speak with the same healthcare members means they can accept, but if you discuss the patient problems with the other people means other than the healthcare team members, that is not good. Okay, that is called as social barrier. Okay, try to communicate all the patient problems with the healthcare team members. Okay, no need to speak with the other peoples. Okay, then fifth barrier, cultural barrier. Customs, tradition and cultural background is different from one religion to another, like it may be Hindu or something. Okay, means according to their culture also one of the barrier which affect to maintain a good IPR. Okay, then semantic barriers means mainly it is related to what language, way of speaking with the patient, by which language we are using means more convenient language we need to use while we are going to communicate with the patient. Okay, then seventh one, organizational barrier means we have to organize all the things with a particular items or equipments. Okay, means organizational barrier, it is also main thing. Okay, it is also play a vital role. Okay, means way of organizing the things, it's most important. Means if you are going to do dressing for the patient, that time if you take some tray or something by using the equipments or the articles, that time patient can be calmly. Okay, if you are going to do dressing, if you hold those items, a spirit or dressing table something, okay, if you hold in your hand means it's not good. Okay, way of arranging is most important. Then this is also one of the barrier which affects the IPR. Then communication process related to barriers, while we are going to communicate with the patient, okay, that time we need to use some what trust. Okay, if you want maintain a good what communication skill with the patient, that is also became one abstract, sorry, some barriers in the individuals.